Welcome to Alivio Medical Center / Alivio Physical Therapy. My name is Dr. Anthony Hillibrand. Today we are going to do a mini case study on Bell's palsy. Bell's palsy is a surprisingly common issue in the Hispanic population, which is largely the population I work with. I have seen it in other races, but it's a little bit more common from what I've seen so far in the Hispanic population. So what Bell's palsy is an issue with the trigeminal nerve. Trigeminal nerve comes out about here, comes here, and it comes to the muscles up here, and then the muscles, sorry, doing this backwards, through here. So what people develop is they lose control of their face. So they have facial droop. Oftentimes they'll end up in the ER because somebody thinks they're having a stroke. Which, if you have those symptoms, that is the place to go to start with, because you'll survive Bell's palsy. You might not survive a stroke, but you can't tell the difference, so just go get checked and then address accordingly. Now, typical medical side of treatment is they may give you antivirals if they think it's, a virus-related issue. They may give you antibiotics if they think it's an infection issue, which an infection issue is rare from what I've seen. I've seen it probably a little bit more on the viral side. And then they'll typically give you steroids, so like a Medrodose pack, prednisone, something along those lines, to decrease the inflammation on the nerve, to hopefully have function return sooner. Now, issues these people have, of course, they can't have facial expressions on that side because the muscles just aren't working. They also have difficulty when they eat and drink because they can't keep their mouth closed, so food and water comes out. They have a hard time sniffing, but that is what it is. Most patients don't really care if they can sniff appropriately or not. So the big complaint I get is they can't keep their eye closed at night, so they have lots of dryness issues. And they may not be aware of their contacts. So with those patients, we do twofold treatment here at Alivio Physical Therapy. We'll use electrical stim. We have two ways. We can do needling if we're targeting really, really specific muscles, or we can do patches. Plus, it depends whether or not the person will tolerate the needles, because people have needle fears. Now, usually people, after they have needling done, even if they have fears, they want to do it again because they feel better. But we have two options. The other thing we do is we have a specific set of exercises we have them do, and the expectation with them is they do the exercises. And we're going to have them do them after the electrical stim to take. We use the stim to kind of prime the muscle to start moving, and then we follow up with the exercises to reinforce that firing. You can't do electrical stim by itself and expect great results. It just doesn't work that way. So it's a combination of things. So after we get through the electrical stim, we run them through the exercises, and then we give them a handout for their exercises. And we tell them, we expect you to do this every day as often as possible. If you do, it 30 times, perfectly fine, because these are more of an endurance muscle, so they're meant to work all day. So typical response as far as how quickly I see people recover, it's a little bit variable. I do have about 5 or 10% of my patients who their recovery is limited. We usually recover the eye. The mouth is a little trickier, but patients will gain the ability to at least keep food and drink in there, but smiling might be off a little bit, but we really want to make sure that eye closes, because you can get around the other issues, but your eye not closing at night in particular, where you got to tape it closed, is more of an issue for most people. So we try to make sure we definitely get that one, and then make sure eating and drinking, and then facial expressions afterwards. You know, we want to get people to the point where if they're having a conversation with somebody, the other person really doesn't notice it unless they're really looking at it. And most patients are happy with that time. I've had patients bounce back as quickly as 4 or 5 treatments, and other patients kind of in the neighborhood of 15 to 20. But that's rare. My average is probably around like 8 to 10, give or take, where we start to see significant differences. So the evaluation basically consists of, we're going to look at you, we're going to see how much you move, we'll compare it to your other side. So if, you know, your right eyebrow comes up, 4 millimeters, and your left one only comes up 2, then we have our starting point, because we want to balance it out. Because if you're equal side to side, most of the time in conversation, nobody's going to really notice. So that's kind of the approach that we take with Bell's palsy. It's, a simpler form of treatment, but it can be very effective, especially if you start earlier. Although I have had a few patients here at Lay who I've seen their friends who had Bell's palsy, and they had it, 2-3 years ago, and they came in, and at least half of them that show improvement within 2-3 weeks. So while I can't guarantee if you've had this for 5 years that we can make a significant difference, it's worth a shot, especially if you've had no treatment in the past or you didn't have much treatment. So if you have any questions or comments, throw them in the comment section below, or you can come visit us at aliviophysicaltherapy.com or AlivioPT on Facebook, and make sure to subscribe to see additional videos. Thank you.